Hi, doctor. Honestly, I have been feeling really anxious lately. It's been difficult to focus, and I have been having trouble sleeping. Hi, doctor. Honestly, I have been feeling really anxious lately. It's been difficult to focus, and I have been having trouble sleeping.
I'm sorry to hear that. Anxiety can definitely take a toll on both your physical and mental well-being. Can you tell me more about what's been going on?
Well, it feels like there's always this sense of dread looming over me. I worry about everything, from my job to my relationships, to my health. And the more I worry, the worse it gets.
It sounds like you are experiencing a lot of intrusive thoughts and rumination, which are common symptoms of anxiety. Have you noticed any physical symptoms as well?
Yes, I have been feeling tense all the time, especially in my chest and shoulders. And I have been having these really intense panic attacks, where I feel like I can't breathe.
That sounds really distressing. It's important to remember that you are not alone in this, and there are strategies we can explore to help manage your anxiety. Have you tried any coping techniques or relaxation exercises?
I have tried deep breathing and meditation, but it's been hard to stick with it consistently. I just feel so overwhelmed most of the time.
It's understandable that it might be challenging to find the motivation to practice these techniques when you are feeling overwhelmed. Sometimes, starting with small, manageable steps can make a difference. We can work together to develop a personalized plan that fits your needs and lifestyle.
That sounds like a good idea. I'm willing to try anything at this point to feel better.
Great! In addition to relaxation techniques, we can also explore therapy options, such as cognitive behavioral therapy, CBT, which has been shown to be effective in treating anxiety. And depending on your specific situation, medication may also be an option to consider.
I'm open to therapy, but I'm a bit hesitant about medication. I have heard about potential side effects, and I'm worried about becoming dependent on it.
It's completely normal to have concerns about medication, and it's important to weigh the potential benefits and risks. Medication is just one tool in the toolbox, and it's not necessarily the right choice for everyone. We can discuss all your options in detail and make an informed decision together.
Thank you, doctor. I really appreciate your support and guidance.
Of course, that's what I'm here for. Remember, healing takes time, and it's okay to ask for help along the way. We will work together to find the best approach for managing your anxiety and improving your overall well-being.
I'm grateful for your reassurance, doctor. It's comforting to know that I'm not alone in this journey. I have been feeling quite isolated lately, and it means a lot to have someone to talk to about all of this.
You are never alone in this, and it's important to have a support system in place. Whether it's friends, family, or healthcare professionals, having people who understand and care about your well-being can make a significant difference.
That's true. I have not really opened up to my friends or family about what I have been going through. I guess I'm worried about burdening them with my problems.
It's understandable to feel hesitant about discussing your struggles with others, but remember that sharing your feelings can actually strengthen your relationships and provide you with the support you need. Your loved ones likely want to help you, and they may be more understanding than you realize.
I will try to keep that in mind and consider opening up to them. It's just hard to admit when you are not feeling okay, you know.
Absolutely, it takes courage to acknowledge your struggles and seek help. But remember, reaching out for support is a sign of strength, not weakness. And taking care of your mental health is just as important as taking care of your physical health.
Thank you, Doctor. I will do my best to prioritize my well-being and follow through with the recommendations we have discussed today. It's a relief to know that there are options available to help me manage my anxiety.
You are welcome, and I'm here to support you every step of the way. We will work together to develop a plan that works for you and helps you feel more in control of your anxiety. Don't hesitate to reach out if you have any questions or concerns along the way.
I appreciate your support, Doctor. Thank you for listening and for providing me with guidance and reassurance. It means a lot to me.
You are welcome, and remember, I'm here to help. Let's take this one day at a time, and we'll get through this together. Take care, and don't hesitate to reach out if you need anything.
Thank you, Doctor. Take care as well, and I will see you at our next appointment.
Welcome back. How have you been since our last appointment?
Hi, Doctor. I have had some ups and downs, but overall, I think I have been doing a bit better. I have been trying to implement some of the strategies we discussed, like practicing relaxation techniques and reaching out to my support network when I need it.
That's great to hear. It sounds like you have been proactive about managing your anxiety and taking steps towards improvement. Have you noticed any changes or improvements in your symptoms?
I think I have been able to cope with my anxiety a bit better, especially when I'm feeling overwhelmed. The relaxation techniques have been helpful in calming my mind and reducing my physical symptoms.
That's fantastic progress. It's important to acknowledge the small victories along the way. Are there any specific challenges or triggers that you have been struggling with recently?
Well, I have still been experiencing some anxiety in social situations, especially when I'm around large groups of people. It's like my mind starts racing, and I worry about saying or doing something embarrassing.
Social anxiety can be challenging to navigate, but it's something we can work on together. Have you tried any exposure techniques or role-playing exercises to gradually desensitize yourself to those situations?
I have not really tried exposure techniques yet, but I'm willing to give them a shot. It's just intimidating to put myself in those uncomfortable situations, you know.
Great! We will work together to develop a personalized exposure plan that suits your needs and comfort level. And remember, it's okay to take things at your own pace and practice self-compassion along the way.
That sounds like a plan. I'm willing to give it a try if it means reducing my anxiety and improving my quality of life.
I understand, and it's natural to feel apprehensive about facing your fears. But exposure therapy can be a powerful tool for overcoming social anxiety and building confidence in social settings. We can start with small, manageable steps and gradually increase the level of exposure as you become more comfortable.
Thank you, Doctor. I appreciate your guidance and support throughout this process. It's reassuring to know that I have someone in my corner who understands what I'm going through.
You are welcome, and I'm here to help you every step of the way. Remember, progress takes time, so be patient with yourself and celebrate your achievements, no matter how small. We will continue to work together towards your goals, and I'm confident that you will continue to make strides in managing your anxiety.
Thank you for your encouragement, Doctor. I'm feeling more hopeful about the future knowing that I have your support. I will keep you updated on my progress, and I look forward to our next appointment.
I look forward to hearing about your progress as well. Remember, I'm just a phone call away if you need anything between appointments. Take care, and keep up the good work.